Thank you very much for this opportunity, and I'm sorry that I cannot be there. I'm also representing the European Academy of Neurology Epilepsy panel here. And can I have the next slide, please? So, of course, after 2014, there has been international consensus that valproate is a major teratogen, and alternatives should be offered. But as we heard, there is a timeline that has the knowledge of the teratogenicity of valproate has evolved. And if we think about the years before 2002, so from 1984 to 2002, we only had knowledge about the major malformations. But I should say that, of course, we informed the patients about the teratogenicity and risk of malformations of all the major anti-epileptic drugs of our patients, for our patients, and we just didn't know the relative comparable risk of malformations of valproate at that point. And it was only between 2002 2009 that we started to get more information about the fetal valproate syndrome and the larger risk of valproate, and as said, 2009 and 2014 about the learning disability and autism. So we need to, when we discuss now about the situation, we need to think about this, the timing of the knowledge that has evolved. And we need to also remember that during the same period, we did not have the same alternatives that we have at the moment. And what we know at the moment perhaps cannot be then in future. It might change also in the future. So we might think differently about the advice that we are giving at the moment in future. So when we think about the doctors and neurologists' view about this discussion, sometimes I can understand my colleagues that they sometimes feel that this whole debate has been somewhat unfair towards them, and that has been the background of some of the discussion among the neurologists. So, for example, these articles and statements that women still are not being told about pregnancy risks. I think many of the doctors have tried to do their best, giving the information and knowledge that we have had at various points. But of course, it's true that from 2014, people should have been informed about the risks. So next slide. So I agree that the questions that doctors had prior to the hearing were somewhat similar as the patients, as we heard earlier. So we were wondering whether they already had a decision that has been made, and this was only some sort of PR activity that was made by email. Can I have the earlier slide, please? Can I have the earlier slide, please? The slide before.
No, I think we are on the next slide. The questions for patients are similar to the doctors. No, just one back. Yeah,
yeah,
thank you so much.
Yeah. So So we really wanted, of course, also the doctors wanted to contribute. There are some problems. So this one now this one should be the one. So we really wanted to contribute to the decision making. Of course, doctors were afraid that there would be accusations and are looking for responsible persons, and of course there have been these court discussions and financial compensations. But what we really were looking for, that whether Prague would make sure that it would get a balanced view, and whether there would be patients with various situations that could be heard. And also those girls and women who desperately need valproate for treatment for their epilepsy. And unfortunately, that didn't happen. That's probably the most important thing that I would wish for the future to happen, that we could hear those people. There was many people in 2014 hearings and also here that had this main assumption that you could ban the use of valproate and that the valproate being a major teratogene and being this consideration would override all the others, so that if we only would give the information to women who wish to become pregnant, they would not take valproate if they knew the risks. And if women taking valproate, even that they should really not be permitted to become pregnant. And if women only would know the risks, they rather would not have a disabled child, or they would really not get pregnant. So this warning was really the major issue. Next one. So next slide, please. Can I have the next slide?
We have here the next slide on the screen. It's questions doctors had prior to the hearing, and also how we as the neurology community. That's the slide that's currently up.
We have a little bit timing issue because now I see it. Yes. So doctors would have liked to also hear from the patients these voices, and now it went so that we only heard the patient voices from those women and their children who have these teratogenicity problems and learning difficulties, autism problems, but we didn't hear the voices of those patients who really needed valproate for their treatment and even would have wished to become pregnant. And we do have these patients still. And then, of course, we have families who have really severe epileptic encephalopathy problems, and they need for their children this, and also daughters, valproate. So doctors needed to testify for these patients, and that was a little bit unfair. So the diversity of the patients wasn't there, unfortunately, and that's something to us for improvement of the public hearing. Of course, we doctors see also that we actively need to identify those patients that unnecessarily still use valproate. Next slide. Then before the hearing,
Mrs. Kalfiainen, sorry to interrupt you, but there are so many slides still to go, and you have 5 minutes. May I ask you?
Yeah, go quickly. So next slide, please. So what we also prior to hearing, they're afraid that the publicity that generates fear and anxiety without sort of evidence of the benefits of valproate would result in women stopping their treatment. This has happened, so that was one of the problems. Can I have the slide number 7? So the experiences from doctors were positive in a way that we felt that all the opinions were listened to, and different opinions could be confronted. And as said, doctors needed to speak for the part of the patients, but that was heard. And can I then have the slide number 8? So also the one experience from the hearing was that much of the discussion dealt only about the warnings and how to prevent the use of valproate, but more could have been discussed about the very complex and situation of adequately inform the patients and the women about the issues related to this situation and how they could then themselves do the informed decision between different treatment choices. Can I have slide number 10? Because as was also discussed very shortly about by the patient representative, is that there are so many different alternatives which also have risks of major congenital malformations and of the risk of learning difficulties that we are not aware of. So here you can see the risk of major congenital malformations with different anti-epileptic drug monotherapies, and with higher doses of some of the drugs, it's nearly the same as with higher doses of Valproate, and therefore we are in a situation that we would also need to discuss about the risks of other anti-epileptic drugs. Can you go to the slide number 12? We also need to think about those ladies that need, when they stop Valproate, they need polytherapy, or also those ladies that need polytherapy overall. So the risk of polytherapy regarding teratogenicity is as high or even sometimes higher than Valproate monotherapy, as described in here by Vadia et al. In 2016. And again, this is something that our patients are now asking, and we need to also discuss about this when we are discussing about the informed choices of the therapy. So I go now to my conclusions. So the slide number 13. So the decision-making surrounding Valproate will remain very complex, and some of the complexity was not so much discussed during the public hearing, although it was very successful in a way that we, when the doctors gave the view of some of the patient situations which were not presented by the patients themselves, which would have been better, then the conclusion that was made by Prague was, I think, was excellent, and also satisfied, I think, neurologists view very well. The last slide. So some last thoughts. I think one of the things that came very clear was that the parents of the children with fatal Valproate syndrome and other problems, they expressed a lot of grief and anger, and that comes partly from the fact that they have got inadequate support for those disabilities that have emerged from Valproate. And of course, this support should be given regardless of the etiology of or the causality, and this we need to take care better. But my personal impression also is that many women now decide not to have children at all with epilepsy after this discussion, and that might also risk the risk of increased stigma related to epilepsy, and that's a little bit sad outcome of all the publicity related to this issue, and we should also tackle this problem better. Thank you for your attention.